Hey, Dr. Gila here. Just like for a lot of you, summer in my world means things look a little bit different. And so I'm practicing what I preach, as it were, and taking a little bit of time off from recording new podcast episodes. Instead, I've decided to air replays of some of my most popular episodes. These are the ones that seem to really resonate with all of you, and for good reason. These are all topics that are so universal and so important, and so I hope a refresh and a re-listen will be really helpful for you over the summer. I also want to mention that if things are feeling hard and you have a lot of meltdowns in your home, I do have a free printable guide that walks you through my simple visual metaphor to help you understand why you and your kids have a hard time, lose it, snap, all of those fun things, and an acronym to help you remember the 7 main categories of things that can contribute to those big meltdowns and other tough episodes. Go to parentingwithconnection.com/guide. I'll also put the link in the show notes for you. All right, now on to the show. Tantrums and meltdowns and rages, power struggles, aggression, all the things. These are some of the hardest parts of parenting. Today, we're going to dive into what's going on, why our kids lose it. And I'm going to share with you a simple framework that I think will help you start to think through and better understand what's going on for your child. So let's dive in. Welcome to Single Parenting with Connection, Not Perfection, the podcast that honors your messy reality. It's the support you crave without the usual emotional landmines. I'm your host, Dr. Gila, and I promise I will never tell you to just tag your partner in. Before we start, quick reminder. While I am a licensed psychologist and a certified coach, this podcast is not coaching and it's not therapy, and it's not a replacement for medical or psychological advice. It is for educational and informational purposes only. All right, let's dive in. We are talking today about why kids lose it. In working with clients and supporting my own kiddo, I have discovered that the most helpful, powerful mindset is these are our children having a hard time. They are struggling. I think Ross Greene was the first one who said kids do well when they can. I think that applies to everyone. We do well when we can. And when our kids are having a meltdown or a rage or a tantrum or whatever it may be, they are struggling. They are having a hard time. And that shift is so foundational because it really shifts you from seeing your kids' behavior as something they're doing to you, maybe to make you mad or to misbehave, to be defiant, whatever it may be, shifting it to a caretaking lens. My child is struggling and they deserve and need my support. They are not misbehaving and need to be punished. So that is sort of this foundational, fundamental shift for a lot of people, or a mindset that I think can really help you move through and support your child in a way that meets their needs and that can ultimately yield better results. Now, I know a lot of you might be thinking, no, Dr. Gila, my kid knows exactly what they are doing. They look me in the eye and then do the other thing, or they are intentionally trying to throw this meltdown to get what they want. And I hear you. There are different degrees of control and intentionality involved. And I'm not saying that your child never has any sense of what they're doing and why they're doing it or trying to get what they want. In fact, to some degree, I think all behavior is an effort to get what we want or what we need. Behavior is communication, and our kids often don't have the skills to communicate their needs in a healthy, productive, effective way. And to be honest, a lot of adults don't either. Kids are not the only ones who lose it, right? Kids are not the only ones who have tantrums and meltdowns and rages. It's hard for all humans, right? When we have emotions and needs and desires that we don't know how to get them met, it's going to come out in these tough behaviors. And yes, some of them may have a degree of intent behind it, intentionality behind it. I personally believe that even the ones that are sort of top down, as we call it, so there's bottom up and down, as you may have heard people talk about. Top down would be when the thinking part of your brain, which is sort of the top part of your brain, is informing and sort of trickling down to the lower part. I do think that even then, even when there is thoughtful, premeditated intentionality behind it, there is a degree to which they are struggling. There is a need that isn't being met, or a desire, a want that isn't being met, and they are doing what they can to get that met. I did have someone once tell me that their 6 month old was manipulative because they would cry when they wanted I don't remember what it was, but then let's say when they wanted to be picked up. And my thought on that is that if we think of manipulation as doing something in order to get your needs or wants met, then I guess they are manipulative. But manipulative has such a negative connotation to it that there's this sort of like malicious aspect to it, malicious flavor, malicious intent to it. And I just don't believe that a 6 year old, or that a 6 month old or a 6 year old is doing it with a malicious intent. I believe that they have a need, they have a want, they have a desire that they are trying to get met in the way that they can, in the best way that they can. And so the behavior is that communication. It is, you may have heard also the analogy of the iceberg. I believe Mona Delahook might be the first one who used that to talk about kids' behavior. I'm not sure. But anyway, you've probably heard it in a lot of places at this point that behavior is sort of the visible tip of the iceberg. But really, what's happening is there's so much more underneath the surface that is not the behavior. It's not as visible, as easily visible. But that's under the surface is really what's driving the behavior. What's underneath the behavior. And if we can better understand that, then we can better understand how to support our kids. So the first piece, if you take nothing away, nothing else from this episode or even this podcast, to be honest, I think one, like the core foundational piece message that I want to send is when our kids, quote unquote, lose it, and I will say when adults do also, but when people lose it, that it is because they are struggling, because they are having a hard time, and shifting into how can we support them instead of how can we punish them, I think is a really powerful and effective mindset shift. So now I want to talk about why are they having a hard time? And there's two pieces to this. I do have a free PDF guide that goes over all of this, and I'll put a link in the show notes. You can get it for free straight to your inbox. And there's two pieces that I go over in that PDF and that I'm going to touch on today. The first is the sync. And I talked about this a lot in episode 2, where I talked about emotion regulation and I laid out my sync model for emotion regulation. So I'm just going to briefly tell you here, which is that each of us have this metaphorical sink inside of us. And when the sink is really full, just a few more drops of water are going to make it overflow. And that overflow state is dysregulation, when your child will lose it. They're going to have a tantrum or a meltdown or a rage or whatever it may be. When their sink is emptier, the same drops of water that led them to dysregulation in that first scenario, they're going to be able to handle that and even more. And so it may sometimes seem like your child goes from 0 to 100 in 2 nanoseconds flat, that you can't predict when they're going to lose it, and that it doesn't make any sense why they're losing it. There's no blueberries, and suddenly they're having a hour-long meltdown on the floor because there's no blueberries left. When last week they were totally fine when there was no blueberries, or maybe They were sad, but they certainly didn't have an hour-long meltdown. And so the sink model helps explain why that might be the case. So it might seem like there's no rational reason why they are suddenly having a meltdown and it came out of nowhere. But actually, one of two things happened. Either there was something about that situation that really was a bigger gush of water into their sink than you realized. Or two, their sink was already quite full when that stressor happened. And so that's why last week they did not devolve into this horrible meltdown. And this week they're on the floor flailing and screaming. I work with a lot of clients who have kids who are strong-willed, are neurodivergent, maybe have explosive, frequent meltdowns, rages, and that sort of thing. And part of the work in trying to start to reduce the frequency and the intensity, how bad these episodes are, is to start to learn the signs of when your child's sink is getting full so that it doesn't come out of nowhere and so that we can start to intervene earlier. And I talked about this in episode 2 also because it's the same thing that's the first step in our own work with ourselves, learning our own cues. And another piece that's important to know is that one of the things that can fill your sink really quickly is somebody else's sink overflowing into yours. And this is often what happens when our kids' sinks overflow, and then they overflow into our sinks. And if our sinks are already quite full, our sinks are going to overflow and that fills their sinks. Or maybe it started with your sink overflowing and that filled up their sink and led to their overflow. So it's very much interrelated and it's important to look at both pieces of that. And of course, I want to acknowledge here, this is a podcast for single parents and most of my clients are single parents. I'm a single parent. And I know that one of the hardest things about being a single parent is that you don't have a lot of breaks. You don't have someone to tag in so let's say you notice that your sink is really full. You don't have someone to tag in necessarily to remove you from that situation and prevent your sink from overflowing into your kids. Or when your kid's sink is overflowing, you can only handle so much. And it makes sense that it's really hard, especially if you have a kid who's having meltdowns, rages, whatever it may be, every day or frequently, or if they're really intense when they happen, of course it's going to be hard for you to keep your sink from overflowing. It's really challenging. And I just want to name that. And that's part of why this work outside the moment, because in the moment, there's only so much that we can do. The real work comes outside the moment when we can start to, like I said, tune into what does it look like when my child's sink is starting to get full, and what are some of the things that tend to fill their sink more than others. So part one is learning to recognize those signs, signals, cues that your child's sink is starting to get full. And of course, the ideal is to also help them start to recognize their own cues, recognize their own internal sync. The second piece is learning to recognize or to understand what are the things that fill your child's sink. And this is going to vary, right? As they grow, it's going to change. And even within moments and days and months, it's going to change. But there are some common themes. And I do have a framework. Like I said, the PDF guide, go ahead and download that. There's a printable fridge sheet that shows you the framework. It's an acronym, the SPIES, the SPIES. And so it's THESPIES, the SPIES. It lays out the 7 most common, sort of biggest categories of things that might be filling your child's sink. And I should say also your sink. A lot of them are overlapping. I don't have time to go into all 7 of them today, but I just want to highlight a couple of them. The first one that I want to highlight is something that I call CAP, CAP, control, autonomy, and power. If your child is a strong-willed kiddo, CAP is their currency. Our strong-willed kids crave, yearn for, and need control, power, and autonomy. I would say that that's true for all kids, and in fact, for all humans. But our strong-willed kids feel it even more deeply. And I want to point out that, there's a lot of strategies out there of, giving your kids choices and that sort of thing, which I think is great. But our strong-willed kids are very sensitive and attuned to control, autonomy, and power. And often when we do the whole, do you want the red shirt or do you want the blue shirt choice thing, for some kids, that's going to be super helpful and they're going to really respond well to that. For some kids, they're going to kind of call your BS on it. They're going to feel like you are giving them false sense of control and power. And it isn't really the kind of control and power and autonomy that they deeply crave. So if you have tried these sort of tactics of giving two choices, for example, and it hasn't worked all the time, or it doesn't work the way you want it to, this may be part of what's going on. And so I know you're probably thinking, okay, but Dr. Gila, I can't give them all the power, control, and autonomy in their life. They're kids, and that's just not how it works. And I hear you. I do think that there are more places in their life that we probably can give them a little bit more actual, authentic control and power and autonomy. And that's going to look different for each kid. So, this is a place where really getting personalized about it is helpful. Um, but one of the tools that can be incredibly powerful if you have a child who is developmentally capable of this is to have proactive conversations with them. So, proactive meaning not in the moment when they're having the meltdown or the rage is not the best time to have these conversations, but planning ahead to have conversations where you're not just giving lip service to getting their perspective and input, but where you are bringing authentic curiosity to the conversation to try to better understand their perspective and their needs. We'll talk more, I'm sure, in another episode about those conversations and communication, because I think communication is so huge. But I just want to kind of lay that out there as a general principle. And if you do want to work more on that, that is something that I help clients with all the time. This is a big piece of showing up in this more respectful way in relationship with our kids. Now, the THE is thoughts and emotions. And I want to go over a couple that I think are particularly important when it comes, again, to our strong willed kids. One is I'm going to sort of lump three together. They are separate, but they are kind of in a similar category in my head. And that is worry, anxiety, and fear. They're sort of different levels, different sort of manifestations of a similar vibe. There is often anxiety underneath and maybe even full-blown fear underneath a lot of these really big behaviors that we see in our kids. And it's very hard sometimes to see that more tender emotion of anxiety underneath the really sort of sharp and difficult behavior that you're seeing when your child is kicking you, is yelling, I hate you, is, scratching you, whatever it may be. It's hard to see that tender anxiety underneath it. But I'm telling you, it is very, very often there. And so reminding yourself in that moment, I wonder what is really hard for my child right now? What feels really hard and maybe really scary? Another really prominent emotion that they are very sensitive to is shame. We're all sensitive to shame, but I think our strong-willed and explosive kids are even more tuned in to shame. Shame, they notice it more and it affects them in a really big way. It can latch on. And there's actually an interplay, I think, between anxiety and shame, where there can be shame about your anxiety, and you can also feel anxious about situations that might bring about shame. So, these are two things that I invite you to think about when your child is having a meltdown or a tantrum or a rage, whatever it may be. When they're having a big hard episode, ask yourself, is there something that they may be feeling shame or anxiety or fear about? And then the last piece that I want to address here is something called rejection sensitive dysphoria. And this kind of goes into the thoughts and feelings category. And the idea here is that some kids, and actually some adults also, some humans, are more sensitive to, first of all, they interpret things as rejection that aren't necessarily rejection. And then when they perceive that they are being rejected, they feel it deeply. They feel it deeply. And this is, again, it plays into the fear and the shame piece. There may be a lot of anxiety or fear about being rejected, and a lot of shame if they do feel that they have been rejected. And I mentioned the thoughts piece here because our thoughts influence our feelings, and our feelings influence our thoughts, and both of them influence our behavior. And in a child who has rejection sensitivity, or in a human who is sensitive to rejection, the thoughts that come up are often these automatic thoughts, these interpretations of other people's behaviors and words. And that interpretation then really triggers this emotional response, which then triggers this behavioral outburst. So, those are some things that I think are especially important to keep in mind when it comes to strong willed kids, explosive kids, and some forms of neurodivergence. There's a lot more here, though. So, like I said, there's 7 categories, and then within each of the categories, there are a bunch of different things to consider. So, I invite you to download this guide. It's 100% free. It'll go through each of those 7 categories and some examples of the kinds of things in that category. And if you have any questions, please feel free to reach out. And of course, if you want support in trying to identify what it is for your individual child that is filling their sink, and how can we catch it sooner before their sink is all the way full or overflowing, and how can we intervene when their sink is really full or on its way to being really full, or even when it's overflowing, please let me know and I would be happy to support you. So, the last piece is that often the spies, all these different factors that fill our kids' sinks, the spies appear in disguise, is what I like to say. And what this means is that behaviors that we might label as defiant or manipulative or obnoxious or disrespectful or whatever that may be, I think of those as disguises. Underneath them are usually one or more of the spies. So, in the next 2 episodes, we're going to dive into a couple of those disguises. One is aggression. I know aggression is particularly hard to handle as parents, and then even more so if you're the only one handling it all the time and you don't have anyone to tap in. So, I'm going to talk with Tasha Shore about aggression. And then I have an interview with Danica Maddox. We're going to talk about power struggles because power struggles, even though they may not feel like a big episode of your child losing it, this is another example of when your child is having a hard time. And maybe you also are having a hard time in that power struggle. It's hard. So, we're going to dive into power struggles in that episode. For today, thanks for joining me. And as always, please feel free to reach out if you have any questions. And please, I would really, really appreciate it if you would rate, review, and share this show so that more single parents can listen in. All right, see you next time. That's it for this episode. I am so glad you found your way here. And remember, even if you're on your own, you don't have to do it alone. You've got this.